I want to start. I've just got to do that again now, guys.
I can hear you. I don't know whether
Excellent.
the audience
I'm
can hear
now
you.
going live. So, Paul, if you hang on there, I will introduce you. So, welcome everyone. We've got over 130 attendees. Thank you so much for signing in. And I've just been talking to a blank screen for a few minutes, so I'll have to do my preamble again. So, welcome to the Falls Prevention Network webinar. This is the first of 4 for Falls Awareness Week. We've gone all out for doing a whole week worth of events, and I hope your events with your trusts are going well. And I look forward to seeing all these on Twitter. Don't forget, share at Falls Network, at Falls Prevention, Falls Awareness Week as well. So to introduce, the recording has already started. This recording will be made available with the presentations in the next week or so on an event follow-up web page. You will be notified. If you don't get it, then get in touch with myself. Contact details will be at the end. So I'm Neil O'Halloran. I work for Medline as a clinical support, and I also run the Falls Prevention Network and the Harm-Free Care Network. You can follow me on Twitter. I'm ably supported in the background by my colleagues from Medline, mostly Simon, who's going to be helping with the Q&A. So for a little bit of background, housekeeping, if you hear a fire alarm, it means my house is burning down. You don't need to worry. If I hear your fire alarm, then I'm in the wrong building. Cameras and microphones are off, so don't worry if you can't see yourself or hear yourself. But if you want to ask any questions, use the Q&A chat box on the right. And if you like something that somebody's put in there as a question, then put a little like in there and we'll know that's a popular topic to come up at the end. So I'm going to welcome Paul. He was introduced to me by Julie Windsor at NHS England, NHS Improvement, and she introduced me to Paul as a person who's created this movement in his local area in Birmingham to do a walking stick health check week. So without any further ado, I will now pass over to Paul, and we're going to pop you in that box there and send you over to there.
Thanks Neil, thanks Julie, thanks for the opportunity to be able to speak to everyone. Can people hear me okay?
I can, so okay. If anybody wants to put it in there.
That's great. So next slide please.
This is where we test the technology.
So I work in cardiac rehabilitation, and we have a lot of patients who have heart failure, and a lot of them have walking sticks. So what do you think about this picture? You might, depending on what, I don't want anyone to give away their age, but this picture is of a very interesting couple that most of us have heard of, depending on our age, Torval and Dean. Now, did they slip or did they fall? Why this? The amount of people that I come across with unsafe walking sticks, and they keep on using this phrase, I keep on slipping. So when people often associate with someone on the ice slipping, but some people don't slip and some people don't fall, but we'll come onto that a bit later on. Next slide, please. How did the idea develop? So the falls prevention group in Birmingham Community NH Trust, we set up a subgroup, and from that subgroup we decided to work on the idea for the walking stick check. So also Safety Express, which is the patient safety group within Birmingham Community and NHS Trust, they gave us support also as well, and they really liked the idea. Birmingham, a charity that's closely associated with Birmingham Community, they helped us with some ferrules, and also our Director of Nursing and Therapies, Marcia Perry, she was really pushing forward this idea as well. She gives a lot of help and support. Next slide, please. So here's I was going to say the Fabulous Five or the Fantastic Four, but here's a picture of some of us from Birmingham who worked on the idea. You've got Salil, myself, Anna, then you've got Penny and Beverly also as well. So we made up this actual steering group to develop and work on this idea. Next slide, please. So one of the things that I thought was really important is that sometimes when information is developed for patients, the first time the patients see the information, it means that the idea is already launched. So, but before we launch the idea, what we would do, we would draft a poster together, then we would go out to patients who are using walking sticks, and we would ask them the question, does this make sense? And from the feedback of patients who are using walking sticks, we then adapted the poster and we adapted the information, and we kept on adapting, changing and changing. And through showing people the picture also as well, such as other staff across the whole trust, we wanted to speak to absolutely as many people as possible: admin staff, therapy staff, people who knew nothing whatsoever to do anything to do with falls, family, friends, relatives. We asked for their opinions, and we wanted to get something down. Does this make sense? So look at the picture, and does it make sense? So that's one of the things that we actually did. Next slide, please. This is a picture that I took about 10 years ago. There was a group of patients with lung illness, and one of them talked about a fall that he had, while he was using his walking stick. So there was about five people in the group who had walking sticks. So I asked them, can I borrow your walking stick? They all agreed to that. And then I took a picture, and as you can see from here, from the actual picture, that they had virtually, two of them had virtually no tread on them whatsoever, which was an indication that often they can slip because of having no tread on. So the comparison was, in the next part of the picture, you see some car tyres, some with different amounts of tread on, and one of the pictures where you see that the tread on, there's virtually no tread on it at all. So this is the picture that we showed and kept on adapting with our patients who used walking sticks, and then they could easily understand the concept of unsafe tyre with no tread on it, or very little tread on it, compared with a unsafe, the bottom of the walking stick. And again, one of the things that we wanted to do is to make it simple and easy as possible. And one of the hashtags we used on our social media campaign was BCHC's simple thing, because we want it to be really simple and really easy to understand. Next slide, please.
Oops, I'm trying to find it.
So, thank you. One of the hashtags that we started to use was walking stick MOT, and then we came up with a simple slogan: would you drive a car with a worn tyre? Then why use a walking stick with a worn ferrule? And again, this all emerged from the simple fact that someone can easily understand, where someone who's even riding a bike, would you get in a car if you looked at the tyres, and the tyres had virtually no tread in it? So we wanted to keep it really simple, and that is a driving force behind as we developed these materials, setting out in a really simple and easily understandable manner. Next slide, please. Walking stick ferrules. Sometimes people don't know what the name of the bottom of the walking sticks are. So sometimes we didn't use the name ferrule, sometimes simply use the name walking stick bottoms. But one of the things that we really wanted to press home to people is where they could actually get them from, i.e. they could get them from hardware shops, from chemists, mobility shops, and also online also as well. Because what that showed to people, they could easily get them at a wide variety of places, because if someone had their walking stick originally from a hospital, and they during COVID, where we developed a lot of this program, a lot of people obviously during COVID, hospitals had restricted visiting and all the other things that were then diverted to other processes. So therefore we supply people with information about where they could get their walking sticks from to replace the actual bottom part, the ferrule. Next slide, please. I don't know if anyone recognize the blue box? So what we wanted to do is to, in essence, to lay out to someone that if you could turn back time, what are some of the simple things that you could actually do, and what would be the actual benefits? So if you could turn back time, one of the things that you might do, you might change from an ugly ferrule, a bad ferrule, to one that was actually good. And one of the added benefits of that would be is that then, instead of having to call out an ambulance or someone who's had a fall for an unsafe walking stick or for any other reason, then by turning back time, what could someone have done to actually prevent something from happening in the first place? And I think this is one of the key factors, because with something being so simple, and if you were to say to someone, well, if we did this, we can avoid this. If we did this, we can avoid this. But we can't turn back time. But we really wanted to come across what is easily understandable. We can't turn back time. But if we could, what could we do to prevent things from happening that would lead to an ambulance being called out? Next slide, please. With the way the NHS is at the moment, it's very usual that you see on television programs where ambulances are outside hospital accident emergencies, people unable to access A&E, people being treated in ambulances for a wide variety of illnesses. And again, if just one more ambulance can be avoided being sent out to one patient who's had a fall due to an unsafe walking stick, then the ambulance can then be used to look after another patient in another part of the NHS that needs help and support. Could be a heart attack, could be something else. We all hear the horror stories on the news of people who've had falls and then they're waiting extended hours for an ambulance to come out. So again, going back in time, something as simple as having a safe and effective walking stick, just by preventing one fall, that means one more ambulance could be on the road to do other things. And I think it's so important that we don't actually underestimate the power of prevention, falls prevention. Next slide, please. Average cost of a ferrule, sometimes they might be a bit cheaper, might be £4, might be £2.50. In one study in 2010, the average cost of a fall, where someone had a hip fracture, was £8,610, but we are going back to 2010. So these costs are really the £8,610 would be an underestimate of what the cost would be today. And on top of that, the average bed stay for someone who had a hip fracture after a fall, the average bed stay 23.8 days of a hospital bed stay, which again, with the financial pressure that the NHS is under, it's not to be underestimated the cost savings that can be that can be had by preventing an actual fall. Next slide, please. Here we see again the 23.8 days in hospital due to hip fractures, and those are just for the hip fractures that are uncomplicated. So from the uncomplicated hip fractures to those that are more complex, going up to between £45,000. If you wanted the actual source of this actual information, then the source is on the actual slides, and obviously the slides will be sent out available next week or the week after. Next slide, please. So if you can prevent a fall due to unsafe walking stick or for any other reason as well, again, the massive effects can be a huge impact on freeing up hospital bed space and also saving the NHS money, because the economics of anything has to come into the situation, because it's very good to prevent something, but when you prevent something, sometimes it's good to lay out the positive knock-on effect. You could say the side effect of preventing a fall is a massive thing across the whole of the NHS, freeing up hospital bed space. When you free up hospital bed space, it opens up the opportunity for other medical conditions that could be treated. Next slide, please. So, is it possible to free up 23.8 days of hospital bed space? It can be if someone is prevented from having a fall and the knock-on effect. But sometimes we forget other things also as well. If you can prevent a fall, then that means other medical conditions can be treated. Often certain medical conditions can't be treated because there's not a free hospital bed space for the aftercare of an operation. And obviously the NHS is now facing a backlog of operations, cancer, a whole range of different operations. Obviously there's a lot of people get admitted to hospital because of heart failure. One of the massive impacts on the NHS and the cost of heart failure is huge, but a lot of these operations, a lot of things can't be done if bed space isn't free. So sometimes you have to look at the positive knock-on effect of this actual preventing a fall through a safe walking stick or any other methods that we use to prevent a fall also as well. And just to ask yourselves the question, what could your local hospital do with the extra hospital bed space? But it's not just the hospital bed space, it's what can be done when the hospital bed space is free as well. Next slide, please. Okay, so whatever the cost is for 2010, the cost would have escalated where we are in the year 2020. Next slide, please. Accident and emergency departments. And again, by preventing the fall due to an unsafe walking stick, again, there's huge pressure across the NHS on emergency departments. And when we think about what can be done to ease the pressure of these emergency departments, again, simple solutions that can be put into place can have a huge knock-on effect, again, freeing up emergency departments for other things. Next slide, please. These are some of the comments that we've had about the walking stick project. And for those of you who are listening who work in various NHS teams, if you're doing a falls prevention program, it might be really useful to reach out to lymphedema nurses. This is one of the comments that one of our lymphedema nurses made in Birmingham after seeing about the walking stick MOT. This is so simple. With the mobility problems our patients have, this will be so useful. Because if you ever visited a lymphedema nurse or an actual clinic, when you see the patients walk into the clinic, their feet are absolutely massive, even though they've got these oversized shoes that their feet are literally bursting out of their actual feet, which then can contribute to huge mobility problems, and a lot of lymphedema patients, when they have the distorted bloated feet, are at high risk of a fall. So I'd strongly encourage fall prevention teams to connect up with your local lymphedema nurses and team as well. Another comment from one of our admin team in Birmingham. My mum uses one of them. I will check hers next time I see her. From one of the research departments in Birmingham, one of the researchers says, I checked and changed my dad's walking stick regularly since we started about 2 to 3 years ago. She's checked her dad's walking stick on a regular basis. One of the things we hear most often from patients when we look at the bottom of their walking sticks is they say, I keep slipping. And when we check, we noticed that the ferrule was bad. I slipped twice yesterday. We was at Tesco's supermarket in New Ascot in Birmingham. A lady who had an unsafe walking stick, she told us she'd slipped twice the previous day before, so we changed her walking stick for her. And another thing that has emerged quite often as well is walking stick users making this comment, you'd never think to check that. Some of them have had their walking stick for 10 years. So, but I'd probably say out of everything, the most popular comment that we've had is that I keep on slipping from walking stick users. And when we look at the bottom of their walking stick, the walking stick is no good. That's why they keep on slipping, as if they're skating on ice with something. Next slide, please. So some of the benefits of a safe walking stick with the right tread. So again, we use the comparison. Benefits of a car with safe tyre tread. Most people are aware of that. What are the benefits? So fall prevention. Someone doesn't slip, someone doesn't fall. Better posture, more steady on their feet, less slips, and injury prevention. And just going back just a step, where we talk often about better posture, sometimes when you see a walking stick bottom worn down to sometimes a 45-degree angle, and obviously if someone's walking with a walking stick at a 45-degree angle, then it's no good for their posture. So there's multiple benefits. People are going to feel more confident when they move. If someone felt using the walking stick as if they were skating on ice, they don't feel that confident. We all know what it's like when we walk on ice. We walk very casually and very gingerly, and injury prevention as well. But not only when it comes down to injury prevention, a lot of the patients who I work with are often on medication such as aspirin, warfarin, and if they have a fall, then it's not only just a hip fracture also as well, it's the bleeding that comes with the aspirin usage and the warfarin usage as well, that could then contribute to even more severe outcomes for these patients. So injury prevention is a huge benefit of walking stick, a safe walking stick. Next slide, please. Movement is magic. Later on during the week at 12 o'clock, one of the speakers will be speaking about things related to deconditioning, reconditioning. So look out for those later on during the week, all starting at 12 o'clock. But movement is magic. As soon as someone starts to move with a safe walking stick, a gentleman we saw at a retirement home about 2 weeks ago. We changed his ferrule for him on the walking stick. He walked past me about 2 to 3 times, and every time he walked past me, he says, "Oh, this is better. Oh, this is so good. This feels so much better." So it's lovely to hear this feedback from patients who have actually had their walking stick changed. If your walking stick is more firm, more better, less slipping, then you move more. And movement is magic when it comes to using our muscles, everything. Next slide, please. I don't know if anyone recognises these characters. I don't know if Neil or I don't know if Neil or anyone else recognises these characters, but a lot of things that we want to do with prevention often come down to money. So this is a part where I sing a song. If I had a little money, it's a rich man's world. So ABBA, their famous song, one of the themes was, if I had a lot of money, all the things we could do. So what could we do since we started to get a lot of money? Next slide, please.
And yes, I do remember that.
So the local charity, Birmingham Community NHS Trust charity, they provided us with some funding and support. Birmingham Healthcare Charity been absolutely brilliant in supporting the work that we've tried to do to extend the walking stick project. So without money, we couldn't really be doing anything. So they've been absolutely brilliant in their support. So this slide where we're talking about, we've been out to about, it says 5, but this is an update. We've probably been out to 7 or 8 supermarkets where we've set up in supermarkets and changed people's ferrule with the help and funding that's taken place from the actual charity. It says about 125 people engaged. I think now we've probably engaged around 200 to 210 people we've engaged so far. So the increase in the uptake the increase in the uptake in the funding has really allowed us to expand what we've been doing over the last 3 months. We've visited 2 care homes in Birmingham, changed the walking sticks for multiple residents in care homes. That has been extremely useful as well. But not only have we changed their walking sticks, we've also given them other information about falls prevention also as well. So we said to them, okay, well, here's the walking stick. We can change the bottom for you. But okay, have you had your eye test? How about your footwear? When was the last time you had your hearing aid checked? So we was able to then add on other information about falls prevention also as well. Have you got a handrail in your bathroom? So it was really a good stepping stone. We looked to say, we changed the bottom of your ferrule. Now can I give you additional information also as well? Next slide, please. So this again is just a bit more information about the actual funding that we actually had. So the funding has really come from mainly from the actual charity and the additional funding that the charity got. So this slide explains a bit more about where we got the funding and the actual charity from. It's just a bit more additional written information. So this will be, obviously this will be available when you get the presentation later on. Next slide, please. So a couple of faces that we didn't see earlier on. Julie Jones, our patient safety lead, has been incredible support for our project also as well. Susan Cleary, one of the on the board of Birmingham Community NHS Trust, brilliant support. Marcia Perry, Director of Nursing and Therapies, really good support, and also Alex Evans also as well. So it's, even though there sometimes when you do these things, it's a bit like the Titanic. You might only see a little bit of the actual iceberg, but underneath the foundation for this has many people put so much work into getting this done. So this is just to say the recognition for those people of how to help to bring this project to where it is today. Next slide, please. When we visited Tesco's, this is what we found. So I was thinking to myself, you could probably use this for sword fencing. It was that sharp. So the metal part of the walking stick had actually popped out the bottom part of the actual ferrule. So we changed the ferrule for the actual patient, and the patient told us she'd fallen a few times. She was now frightened of falling. When she actually came into the supermarket where we were actually set up, you could actually hear the metal part tapping the actual floor. She'd been to quite a few places to try and find out why she was falling. Could she do anything about it? But finally, when she found us in Tesco's when we were doing our reach out campaign to change people's walking sticks, so we replaced it with a good one, and it was a fascinating story that she told us. We learned a lot from it. Next slide, please. One of the things with the 200 or so people that we've come across, we wanted people to become independent, i.e. we were saying to them, do you use a calendar? They say, yes, I use a calendar. So the first day in every month, I want you to write down for me, check the bottom of my walking stick. So from now on, that's what we will encourage them to do. And also some people who didn't necessarily use a calendar, but they used email, we'd say to them, on your email calendar, put on an email calendar reminder, the first day in every month, check the bottom of my walking stick. And that then gives people a chance to have a any type of memory type impairment, early onset memory conditions, to then remind themselves on a regular and consistent basis. Every month we're going to check the bottom of my walking stick. In that way, then the patient can then self-manage their walking stick safety. Next slide, please. I don't know if you know who this character is. Any guesses?
I kind of think I know that one from nursery rhymes.
That's it. So here we have a picture of Humpty Dumpty. So we all know Humpty Dumpty sat on the wall, but was it necessary for Humpty to have a great fall? And really, even though we talk about Humpty Dumpty, what it takes to put patients back together again once they've had any type of hip fracture, and sometimes not just the first hip fracture, they're often going to have another hip fracture also as well. The incredible work that it takes to put these patients back together again. But if we can prevent a fall, then that is an incredible piece of work. If we can prevent just one single fall, and then we don't have to put these patients back together again if we can prevent it. One place that we went to, this was before we started changing the ferrules. In 7 hours, we found 64 out of 100 ferrules that needed to be changed. 64 out of 100. That is one of the highest percentages we've ever found. Next slide, please. So this is some of the actual supporters, some of the actual team. So we have Anna, one of our patient safety. She's one of the biggest supporters for the actual project that we've actually developed. Then we've got Susan Cleary also as well from our board of directors for Birmingham Community NHS Trust. So we went to ASDA in Birmingham, and one of the reasons why we decided to do this at ASDA in Birmingham is because there's such a diverse community there. We have people from probably 20, 30 different language groups: Urdu, Gujarati, Bengali, Hindi, Arabic. It's like a melting pot for all nations under the actual sun. So we says to ourselves, you know what, if we can do something for the hard to reach communities, then it's then going to be so much easier, because if they understand it, then everyone else can understand it also as well. But our earlier work, when we laid the foundation, when we showed people's pictures, such as car tires with no tread on, ferrules with no tread on. So then we had the good, the bad, and the ugly. This is something that we stole discreetly, but informed them. A team in Scotland, Angus physiotherapy team, and we adapted this slightly, the good, the bad, and the ugly. So that is really saying to people: is your walking stick good? Is it bad? Is it ugly? Then if it's ugly or bad, then it needs to be changed. And from that time forward, we've done quite a few sessions in supermarkets all across Birmingham. Next slide, please. So the next walking stick check campaign, call it the walking stick MOT. It doesn't matter what you call it: walking stick check week, walking stick MOTs. Now, the reason why we're talking about an MOT, obviously, if you've got a car that's more than 3 years old, you have to get it MOT'd, and then you get a reminder. So again, car tire MOT. Often MOT is said to people, all these car tires need to be changed, etc., making something simple. So hopefully we can get as much support as possible during the 14th to 18th of November. And there we've got the hashtag for the event also as well. I think in the next slide, I'm preempting. Next slide, please. So if you have got a camera with what they call the QR code, you could take a picture of this, and that will take you straight to the social media page, the Twitter social media page for the Walking Stick MOT Twitter account. Next slide, please. Final slide. Questions and comments, please. I hope it all made sense.
Yeah, there's lots of comments and questions, Paul. You'll be pleased to hear.
Yeah, oh, that's good.
So we just obviously have to publish them. They come in, we just have to make sure we catch up with publishing them. So everyone should see all the questions and comments that have come in. If you go to the Q&A and you go to the published, there's about 19 questions and comments in there. First few just around, obviously, if you could share, if you like today, share it using the hashtags that we put below, think Falls and keep moving, tag in @Falls_network. I know a few people joined the previous invite. We're sorry about that. It's just, unfortunately, we're a little bit victim of our own success. So hopefully most of you have been able to join this, but obviously we are sending out by the bucket load email with all the live event links for obviously for this webinar and the remaining 3 that we have this week. So coming to the questions. So can they get the ferrule for free?
Currently in Birmingham, at the events that we do, we're giving away the ferrules for free. But I appreciate mobility shops and other places as well. You have to pay for the actual ferrules. Some people buy them online. So there's mobility shops we can get them from, places like Timpson's that are often outside supermarkets. They sell them, people buy them online, hardware shops also as well. But the one we're doing in Birmingham, we're actually giving the ferrules away free.
Okay, great. Okay, in previous Falls Awareness Weeks, we have held walking aid MOTs. I think this is more of a comment, but always useful to share insights on this. MOTs in the foyer of Sainsbury's. Anyone whose walking aid was inspected on the way in was given a sticker, so we didn't grab them again on the way out. Some ferrules were completely worn through or even up to the stick, like your chap in Tesco's. One ferrule on on a frame was so high the foot of the frame had bent up from the contact with the floor.
Yeah. Hear it so often. I've seen it so often also as well. It's shocking. Some people.
I also saw a note about woodworm. Someone posted about obviously if there are patients and people who use the wooden walking sticks, also if they're that old, check for woodworm, because that can also be
I never thought about that.
There you go.
That's a brilliant idea. I never thought of that.
There you go. That's another one for you then, Paul.
Brilliant, thanks.
What profession staff make up the clinic, please?
When you say the clinic, can they?
It's a bit difficult to get them to clarify on this.
Okay, so
if they're here, type more.
Who's in your team, I guess? Yeah.
Oh, in the team that I work with, so we've got with our spread across 2 teams. So in the heart failure team, we have heart failure clinical specialists. We have cardiac nurses. We have there's a whole group, but the team that actually developed and put this together, we've got clinical leads, early intervention leads, patient safety intervention, safety express with the patient safety thing. So really there's a massive team that sort of laid the foundation. Even though I had the original idea, it was a massive team that sort of laid the actual foundation to get all this started. To me, I think the main thing about it to me was is that something so simple. I mean, it's what a tragedy is to, well, people die from having a fall, and if it can simply be avoided by something so simple, how tragic it is not to have people walking around with safe ferrules. And it was so simple and so easy to do. Change your ferrule, get it changed on a regular basis. I don't know if that answers the question, or if the person wants you to expand their question a bit more.
Yeah, I mean, we've got so many questions coming in, so we'll try and get through the ones that we published, and then we'll go back to the list of additional ones that have come through. So just a question around evidence. So what percentage of people who fall whose ferrules, so is there any evidence on the percentage of people who fall whose ferrules were not fit for use? Seems like a key bit of causation link that is needed to justify these cost savings. For all those who fell in the last few months, how many actually had dodgy ferrules on the sticks?
I'd probably say this is that with people that I've come across, I think one lady, we met her in Tesco's Birmingham. She told me she has fallen twice the previous day that I mentioned during the actual presentation. So one thing we've never actually said to people is that how many times have you fallen after you've had your ferrule replaced? But one of the things that we come across when we saw patients in supermarkets and at different places, often I thought the person falls on a regular basis. So we then don't say to the patient, were you using your walking stick at the same time? Were you using your Zimmer frame at the same time? Zimmer frame have ferrules on them also as well. But what we're trying to do at this particular moment in time is really just like identify a need. Okay, so if a patient says to me, I'm slipping all the time, so logically then when we change their walking stick, and the feedback that we're getting is that they're now walking better, it's then logically that they're walking better and they're not slipping because the ferrule on the bottom of the walking stick is now good. I.e., if you were to say to me, produce evidence, I'm not trying to be condescending in any way, but if you were to say to me, produce evidence that car tyres with sufficient tread on them have less slips than a car tyre in the rain with no tread on it, then someone would say, it's obvious. So the only thing I could probably say to them, if I'm answering the question properly, is that when people keep on saying to me, I keep on slipping. So whenever someone comes across whether they have a walking stick, I always say to them, can I take a look at the bottom of your walking stick? Or the ones who've said to me, I keep on slipping, when we turn up their walking stick, the walking stick needed to be changed. I don't know if that answers your question.
Or if the person who put that question on, if there's anything else,
yeah, if they wanted further information, yeah, get in contact with them by all means. Yeah.
Okay, there's a few around. Can we use the hashtags? I mean, Paul, I take it, yeah, pretty of a no-brainer answer. Of course, you'd be happy for people to use your hashtags.
Yeah, share it as widely as possible, please.
Yeah.
And also, we've had questions on, do you have any posters or anything that people could plagiarise that they want to put up in either care homes or in the clinics as well?
Yeah. If you send me an email and a small box of chocolates or triple chocolate gâteau cake, I'm sure some arrangement can be come to. Yeah, by all means, plagiarise what you want, and also go into the social media web page. If you're following us on the Twitter account, send us a direct message, or send us an email. But follow us on Twitter, send us a social media direct message. Then we can send you whatever we can. Also, what I'll probably, based on what the question is also as well, I think what we'll do, just thinking of it, we'll put what we call a Dropbox. We'll put a Dropbox attachment on our Twitter page, so you can download what you want. Yeah,
great. There's quite a few sort of comments and stuff in here, more than questions. A good supply of different ferrule sizes with the general community, as some privately purchased sticks are much small tips. Smaller tips than those we can get from the stores. Also need to check the frames aren't bent, that all the spring clips are secure and the handles are not loose. Also replace walking sticks with woodworm and large cracks. Yes, we covered that before. And then I work with a clinic for amputees as a physio assistant. I try to get as many of our patients to check walking aids, but do miss one or two, if not more. Do you have any? Right, that's the poster one. Sorry, Neil. Yeah.
Okay, no worries.
I know Sue had shared there's some good resources from British Geriatric Society on reconditioning as well. So I think
there's a quick question also, someone saying how good it was today, and also they'd appreciate the slides. We can solve that, but what's happened to the deconditioning, reconditioning, which would have been yesterday? Hopefully we've tried to communicate it as many and as best as we can many times, but that will now take place tomorrow at 12 o'clock. So that's Brian Dolan and Amit Arora doing deconditioning and reconditioning. So if you haven't got the links for the remaining events this week, get in touch and we can send them on to you. I think we need to do a little bit of a mop-up operation.
Can I just say also as well, I think with regards to the actual links, you can also get them off the Twitter webpage also as well, can't you?
Yes. Yeah, if you guys, you can get in touch via Twitter as well.
So the other one, so thanks Paul, we'll share 100%. Can the QR code be shared for today in the chat if possible, and I can circulate to our false groups?
Yeah, that's fine. Share. I'm happy for anything to be shared. I mean, the main thing that we're trying to do is just trying to get as many people to do walking stick checks as possible. And one of the reasons why we went to the actual supermarket is because the amount of people that are actually coming across in supermarkets is absolutely phenomenal, who are using walking sticks and walking aids, and often the first time that we see them when they've had an actual fall is when the ambulance is called out, or you see them in A&E, or they've been discharged after an actual fall, confidence shattered, and if they don't break something. So one of the reasons why we wanted to really work with the actual supermarkets is because, again, going back to what I talked about, that prevention. If you spot someone with a dodgy walking stick in the supermarket, you can not only change their walking stick, you can give them additional information about fall prevention also as well. It could be simple as saying to the person, get yourself a regular eye test, clean your glasses on a regular basis. That your shoes are way too big, because sometimes when I've seen people walk into supermarkets, their shoes are about two sizes too big, and you can tell that straight away. If they're of a certain age bracket, they're at high risk for having a fall. So I'd strongly encourage anyone, if you're going to do any of these events, local supermarket is an absolute it's a brilliant place to start. You're going to find a lot of people.
Yeah. How do you advise people to measure the size of the ferrule they require? Which part is measured and which part is measured?
What we did, we brought as many sizes as possible. I think we bought from 19 up to 25. We bought a whole range of sizes. The only problem that we did have, I'm hoping I'm answering this correctly, the only problem that we did have is that some of the walking stick ferrules were so small. I think they've been brought privately or online, as someone else mentioned. We couldn't actually replace them, so it got to the stage where some of the ferrules, where we took off the bottom part and we had to pull it back on because we couldn't replace it, because we couldn't get ferrules of that particular size. So if anyone knows how to get even smaller ferrules than the actual standard, let us know. It'd be extremely useful.
Okay.
There was somebody who asked about what do you do about ferrules that are appearing glued to the end of a stick. Any advice on how you get them off? I'm thinking angle grinder, sharp knife. I'm not too sure. What's your approach?
I've got a vice that I use. You know, like when I'm showing my age now. When I used to do woodwork at school, you use this vice grip, but you have to exercise a level of caution between something. There's never been one that I haven't been able to get off. Sometimes I've used an actual vice, but it might simply have to be the case where the person might recommend to the person they might have to buy a temporary one until you can actually replace it, because people come in with ones that have sawn down themselves. They've done all type of things to them, so that's a really challenging question. But I've never ever, I'd probably say within the parameters of the NHS, I could only probably say do certain things. But if privately, if one of my relatives says, what can you do about this, then I might maybe find another source that I could actually get it sorted for them. With the parameters of the NHS, there's only certain things I can do.
I've got a question here that's come out a couple of times. Does it take trained professionals to change a ferrule?
Well, what we had to do, we had to go on a 3-year degree course. Then no, only joking. No, it doesn't take a trained professional, but if you do a search on YouTube. I don't work for the company, no commission, don't know anything about them, but one we use in Birmingham, there's a device that you can use to change ferrules. But again, if someone wants to, if you're on the person who asked the question, if you want to direct message me via the actual Twitter account, then I can send you the YouTube link. There is an actual device that you can actually buy to change them. You don't have to be an expert.
Somebody has asked about Twitter accounts in the respect that if they don't do Twitter, can they still access resources? Well, you can still look at Twitter without being a member, and you can still click through and have a look at pictures and links. So resources would be available if you didn't sign up to Twitter, although directly contacting either Paul or myself, and the email address is on the screen, then that's another way of getting in touch.
Yeah, you could. Sorry to interrupt. You could simply do, if you did a Google search for the Twitter hashtag, then the social media profile will come up, so you don't have to actually even create a Twitter account to look at the Twitter account.
There's one question on NHS equipment. It said we're unable to change ferrules on NHS provided equipment. We have to reorder a replacement walking aid. Did you encounter this? If so, how did you overcome it?
That is it's something that I've come across a few times. A really difficult question to answer. What's the best way to this? trying to work with tact and diplomacy to answer this question. The cost of changing a ferrule in comparison to the cost of a whole walking stick, if this is what the question is getting at, is something that needs to be probably looked at a higher level if you're working within the NHS, because obviously there's the cost of a ferrule versus the cost of a replacement walking stick. There's a difference between the actual cost. So it's a really difficult question to answer. Probably say reach out to me via email after you got the presentation. I'll see what I can see if I can help you any further with that.
Okay, great. And is it just walking sticks, or would you check other walking aids as well?
Yeah, me personally, I do normally check any walking aids. If I go out to visit a patient in their home, I check the Zimmer frame also as well. It's always worth checking anything, because sometimes you have Zimmer frame and the ferrules are literally when you walk into the room, the person's on if they're transferring from the carpet to kitchen floor, you hear it tapping straight away. So it's hugely beneficial to check the Zimmer frames as well as the actual walking sticks also as well. But I think one of the top things I'd probably say, help the carers to self-manage, because if you're dealing with patients who maybe got early onset dementia, Parkinson's, things like that, if they have a carer, then try to liaise with the carer also as well, because the reminder thing about the calendar and the reminder thing about the email is not something that's possibly going to be useful to someone who has early onset dementia, Parkinson's, things like that. So if they have a carer, ask them to check the Zimmer frames as well as the walking stick on a regular basis as well.
Okay, great. Just conscious of time now.
Yeah.
So
overrunning, there's still quite a few questions-ish.
As quick as we answer them, they seem to be more seem to be coming in, which is fantastic. I guess it just depends on how much time people have got, really. So
are you all right for?
Yeah.
Are you okay for a few more minutes, Paul?
I'm okay for all the questions are answered. To carry on, that's fine.
We had a question about, where was it? About the falls assessment. It says you obviously give advice, but do you actually do any sort of further falls assessment and referrals on?
What I always do, there's across Birmingham, we're sort of divided up into different areas where there's falls teams across different part of Birmingham. So there would be, we direct people to the actual, if they've got the capability, say for example, someone's who we saw, without giving away any patient information, someone I saw in the last couple of weeks, his mother had a fall, so we directed him to information on the actual website, directing people to contact their local falls prevention team, because some of the areas that we did in Birmingham, some people don't live in Birmingham, so we might direct them to Age UK, have information for falls prevention, the NHS website also as well. But really it's just trying to get people who've never, also sometimes we come across people and we say to them they've had a couple of falls, and we say to them, have you had any input from the falls prevention team? And they say, what's that? So maybe they have input, but they don't recognize it as being the falls prevention team. So one of the biggest things you can actually do is if, say, for example, you could maybe create some little cards, maybe with a QR code linked to the falls information on the official NHS website, or your local NHS falls prevention team, maybe print off some of those on your local, on a mini postcard or something. But we always direct people to the falls prevention team, and also always direct them to reputable websites, and really just a basic encouragement, exercise, hearing aid checks, make sure they've got their diabetes under control, have their foot checked on a regular basis if they're diabetic. But there's a strong encouragement, because the falls team sort of branches out into all the other things. But I think one of the big things we're actually trying to do, a prevention is better than the actual cure.
Yeah.
Definitely. We've had another response to how to get off a tough ferrule. Jam it in a door hinge and pull it off that way.
I think what you're saying does make an awful lot of sense, because I think the only thing is, this is not is that when we do these walking stick checks, because we're on other people's premises, if we were to damage their door or something, but you could buy yourself a little vice from a hardware shop that can get off. I saw one in either, I'm not going to tell you which shop, conflict of interest, Aldi or Lidl. I saw one of these little vices that you could use to remove a ferrule in Aldi or Lidl today. A couple of hours ago, they got them on sale. They might even be on the actual website, so check Aldi or Lidl. They're on sale at the moment.
Okay, there's one. We have some peripheral stock of ferrules, and we can take these out and change for the patients. Does that make sense?
Yeah, that's brilliant. Yeah,
Yep.
that makes an awful lot of sense to actually go out and just be. I think in the end, it's about being proactive, because in the presentation I talked about that turning back time. Sometimes when we talk about turning back time, sometimes when a road accident occurs, sometimes they find out, okay, it was the brakes, it was the tires, it was this, that and the other. So sometimes, okay, they learn from road accidents. Okay, well, what can we do to prevent this from happening again, or what could have been done? What could have been done different? So sometimes what we do as a NHS, if we go into what they call prevention mode, make people aware of what they can do to protect themselves or reduce their risk of a fall, isn't that a whole lot better? Not only related to hip fractures, but also the mental and emotional well-being of someone who's having a fear of a fall, which is going to be dealt with by one of the presenters during the week at 12 o'clock.
Yeah, that's Thursdays. Toby.
Another very quick question for you, Paul. Going back through just streaming back through the Q&A. Any band 3s or 4s on your team?
We have band 2s. We have the band 2's just started. We have another one who's just about to start, because one of the big teams that I work with is our heart failure service team. So in many ways we have a very captive audience, because a lot of heart failure patients use them. Often they come into our clinic, and after they've sat down, I say to them, can I take a look at the bottom of your walking stick? So while they're waiting to see the nurse, we often see them and catch them and change their walking stick ferrule there and then. But we have bands 2, 3, 4, 5s, all the way up through to 8s as our team leaders.
Brilliant. That's really good. And just there was another question around obviously the NHS equipment issue that was raised before. So we order our equipment from Mediquip and can request a replace to change the ferrule.
Yeah, brilliant. That's really good to do. I think in the end, from what I've learned, it's all down to local protocol. What is being commissioned locally, what is going on locally, and it's just about so Mediquip or whoever you want to use. I think the main thing really is what is in the best interest of the actual patient, and I think that should always be the deciding factor about what you want to do. But the quicker you can change it,
the better. Yeah, and the one question on the resources as well. Obviously, we will have a web page that we're pulling together this week, and so next week, or hopefully early next week, we'll email out to everyone with a link to that web page, and that will contain recording of this session, the presentations. I mean, Paul, would it make sense to maybe have some of the resources available on that page as well, or a link to where people can get those?
Yeah, that's fine. I'm easy either way, because what I was thinking of, whatever format we use, that's fine by me. The main thing is the more people access the information, the more benefits that walking stick users are going to get. So I'm happy either way.
Great.
Fantastic. Oh, well, thank you, Paul. That has generated a lot of interest, and it's been hugely beneficial for everyone. There's a lot of going on in the chat. There's been some questions about the next presentation, so there are some this week. There's obviously one tomorrow and on Thursday and Friday, and details are available via the link where you signed up. Hopefully you'll get the follow-up emails. If you haven't had the follow-up emails with the new links, then please get in touch. And I think it's been a very successful kick-off to the week, Paul. Thank you very much indeed.
Yeah, thanks, Paul.
Then can I just say thanks for giving me the opportunity to speak. It's been hugely beneficial to have your company involved in setting up all these things, and I think everything just comes down to the more patients that benefit from these things, the better. So thanks for giving me the opportunity to speak.
You're welcome. You're welcome. I think we got about 280 people online in the end, so wow, that wasn't too bad.
Yeah, brilliant.
Brilliant. Thanks for that, Paul. And thank you, everyone. And thank you, Simon, for fielding the Q&A at the same time. And so without any further ado, I shall sign this off. Thank you and see you tomorrow.
Okay. See you tomorrow, everyone. Thanks.
See you then.
Paul.
Bye.
See you, bye.
Bye. Bye.